Obviously in a cancer centre, all our patients are immunocompromised for one reason or another. They've either undergone radiotherapy, chemotherapy, or just the disease itself can actually affect their immune systems.
We've been looking at CVC infection rates and reducing those. So when the 1,000 Lives came along with looking at devices, it was just a natural step on to look at CORTI and PVC infections.
We found that 7% of our bacteremias were linked to urinary tract infections. We've done quite a lot of work since then in looking at staff knowledge, staff training, protocols and procedures that we already had in place for CORTI, and as a result of the data that we got from that, we've implemented a number of strategies linked to the 1,000 Lives Plus.
Well, when we started looking at it, we realised we didn't have any standard that we were working towards, no policy in place, no standardisation of equipment. So we quickly audited the staff knowledge and found some big gaps and training areas highlighted.
Catheter bundle includes all the key points for evidence-based practice. So it includes things like insertion technique, maintenance technique, and checking on a regular basis if the patient's got any signs and symptoms of infection.
These are the catheter packs. In here is all the equipment that you need to catheterise a patient. Previously, it would be everywhere. The catheters here, your bags, and also in the other room. But in here are your aprons, your gloves, your lubricants, materials to wash the patient, your sterile fields, the catheter. And the catheter's also attached to the catheter bag, so you don't need to break the seal, which could introduce infection.
We've now got standardised care, which is based on good evidence. And obviously we're hoping to see further reductions in infection.
All our patients are only catheterised if they really need it, so if they're septic, if they're in urinary retention.
We have actually been able to demonstrate a slight reduction already in bacteremias. We compile the data that we get every week into a 1,000 Lives Plus monthly report, which then is fed up to the Trust Board.
Now we've got the CORTI bundle up and running, our next priority will be to get the PVC bundle up and running before Christmas.
There's a significant amount of cannulation that goes on. We actually insert over 21,000 PVCs a year.
Patient-driven care to me means that the patient is more involved in their decisions around their healthcare, and they can help influence the direction that their cancer journey or their treatment journey takes.
If you're preventing infection, you are reducing harm.